Hi everyone, I'm Krista with Relivar Home Care, and today we're going to be talking about choosing home care, but we're going to talk about the difference between a Medicare agency and private duty home care. And one of the reasons that we do these community education series events on Facebook Live is because we get a lot of questions about things, during our day-to-day when we're helping people. And we thought it would be a benefit to everyone in the community and people we work with or people who are looking to work with us, that, we talk about some of these things and open it up to people who have questions and want to learn more about some of the things that we know. So, hi, Misty.
Hi, everybody. Thanks for joining us. We're glad you're here. We know when families call us, we get a lot of questions about this. They're typically very confused, right, Krista? Trying to figure out, what they need, where they go, how they get it. They might have gotten a big list from the hospital and their eyes are a little bit glazed over, trying to figure out, what to do and who to call. And sometimes they end up in all different kinds of directions. So usually, I know you take most of the inquiry calls. So
Yeah.
You probably see a lot of that.
Yeah, I see a lot of, part of the reason that I know you and I decided to do this is I get a lot of questions of like, what else should I be asking? Somebody's, saying that, and it's like, okay, well, I'm glad that they trust us to tell them that, but maybe not everybody would. So it's important to talk about it.
Yeah. Finding the right agency is really important. Because depending on who you hire to do that care could either cause you more work or less work.
Yeah.
Yeah.
Exactly.
But today we're gonna start out kind of like in the beginning, like, okay, what is home care? Because there are two types of home care. I call them buckets that we put the agencies into.
Right.
So we gotta make sure that we're in the right bucket. We have the clarity for what type of home care we're talking about in the home. And then the second thing is, just explaining the difference between the two. So that's because it's such a large topic, right?
Yeah, huge.
Yeah. So how do we, break up this elephant into little tiny pieces so people can understand it?
Yeah.
Okay.
Well, and that's part of the reason we're doing episode 1 today.
Yes. So, in episode 1 being, defining the difference between a Medicare agency and private duty home care. People, might leave the hospital or they might be at home, trying to figure out, yes, I need some help, but what does that mean and where do I go?
Right.
So, I think we're going to, first of all, try and kind of dive into the Medicare agency. We call them Medicare, but terminology can be so confusing because everybody believes like home care is home care, but it's not.
Right.
Yeah. So, we call them sometimes Medicare agencies. Some companies call them home health agencies versus private duty home care. But those lines get blurred, wouldn't you say?
Yeah, a lot of the times, people that are calling, are calling, they think they're calling the right place, but really what they're looking for is more of a skilled, the Medicare side of things. And it's confusing,
Right.
for them.
Right. Right. So what we want to talk about first is that whole, Medicare agency. A lot of folks, for the most part, are going to be coming home from the hospital or coming home from a rehab. I'll use the term rehab facility. And, a lot of times that discharge planner will be saying, pick your home care agency, right? And but mom can't bathe herself anymore. Mom, needs more help than that. But, on a Medicare agency, they'll get that big old list or, maybe or maybe not. But a lot of times they end up going with the hospital, home care agency. But we want to let them know that, they have a choice of whoever they want. And that everybody can, not all agencies are the same.
Absolutely. Very true. And, I'm glad that hospitals have a list, right? And, they give it out, but I feel like it does cause some anxiety, when it comes to what am I supposed to do when I'm going home or when my loved one is going home. And, sometimes I think it is easier just to go with the hospital agency because, well, you're there, right? So,
Right.
some of these people, but it's not always the best fit for your family.
Yeah, depending on, how well they're staffed or how well they're run.
Yeah.
But like you have on here, do you want to kind of go through a little bit what bulleted on this, slide?
Yeah. Yeah. So in a Medicare certified agency, they are licensed in the state of Michigan. And if to qualify for a Medicare agency, you must be homebound. So you can't able to go out and go to like a outpatient therapy or something like that, right, Misty?
Yeah, yeah.
Yeah.
You can't be driving. Basically, that's
Right.
what they're saying. You can't drive down the street and then want home care to come in and assist you. In that
Exactly.
instance, they're saying, well, then you can go to outpatient rehab.
Mm-hmm.
Yeah,
Yeah. And then that looks different.
yeah,
So you do have to have a doctor's order, to qualify under Medicare. They have to have specific orders that they are going with, whether it's an RN that's coming in or maybe a CNA to give a bath visit or something like that. It has to be specified from a doctor. And like Misty said, you can choose the agency. So a lot of people don't know that or maybe aren't told that. It is your choice. There are several Medicare agencies out there, and we can help with that too, because we do work with some Medicare agencies that have been really good and have taken really good care of people that, we're providing supplemental services for. So you can talk to us about that too. Um, the services provided are purely skilled services. So that RN, therapist, or does it have to be a CNA through Medicare, Misty?
it does. Yeah. So, you're really kind of looking at like a physical therapy, nursing, occupational therapy, may occasionally speech. And then, yeah, that certified nurse's assistant, which we in our industry call a home health aide for the most part, but those aides are certified by the state of Michigan to do that level of care. But
Right.
not all Medicare agencies will provide that additional benefit of sending somebody in to shower your loved one.
Right.
So it might be one of those questions, really good questions to ask them to make sure that they would have the staff to do that. Because a lot of times coming home, that's one of the biggest safety issues, right? Making sure you get a shower, a safe
Mhm.
shower. But
Yeah.
one thing I like to touch on with this too is Medicare or Medicaid. We use the term Medicare in here because most of our clients are on Medicare, but it could be Medicaid paying for the care as well. But that it's the term they use, intermittent, right?
Mhm.
So it's just going
Yeah.
to really be a short-term situation.
Yeah, I would say that's probably one of the biggest reasons that we get some of the calls that we do is because there's such a discrepancy in, they think that it's all shift work, right? Somebody can come in as often as they need for as long as they need. And that's not the case with a Medicare certified agency. It's truly what we call a visit, right? So, maybe up to an hour if at most, if that, and certain days and times that they can come in and do that service and only for a short period of time. That, it can't continue on for, I need somebody for 6 months. You can't just say that. So you have to be careful with that because, your mom coming out of the hospital or something like that might need a lot more than what a Medicare certified agency can do or will do. And that's where we come into play.
Yeah. Yeah. And I would touch on history, when we first started in business doing home care 20 years ago, the Medicare certified agencies would assist a lot of the folks coming home with helping them set up their medication, because so many times their medication changed from when they went in to when they, came home. But
Right.
that's kind of gone away now. They don't really have time for that. I mean, I've seen nurses do visits as short as 30 minutes or as long as 50 minutes, so but most of the time doing a medication setup does take quite a while. And it is one of the bigger risks, along with showering when they get home, is to make sure they just don't go back on what they were taking before, that somebody, comes in and reconciles that medication, gets the right proper medication. And, sometimes the elderly, they don't feel well. They're just like, it's already in my cassette, or I'm just going to keep doing what I was doing before. And that could recycle them back into the hospital again if that issue isn't resolved.
Yeah, absolutely.
So most of
Medication.
these, go ahead, I'm sorry.
I was just going to say, medication is such a huge thing that we see that, really does change while you're in the hospital, depending on what you go in for, and coming home, that really needs some attention.
Right. Well, and if family's not able to do it, if the client isn't feeling well, we have nurses that could go out for a fee to help them, get that cassette set back up, upon discharge, to, make sure that they're taking the right medication.
Yeah. And also question, did they come home on the right things, or
Yeah.
maybe need to call the doctor and clarify something. I mean, you just never know. So our nurses can do all of those things too.
Yeah, it's funny that you say that, because I just had a situation with my mom like that, because, she's on blood pressure medicine, right? So when I was with her at the hospital and they discharged her, she had pneumonia. In the hospital, they discharged her with another blood pressure medicine. But, I told her, I said, don't take that until we get clarity from the doctor. And so we went to the doctor the next day, and the doctor's like, no, you're on enough blood pressure medicine. We don't want you taking any more. So a lot of those, especially if you're just going into the ER and coming home, like you said, you've got to question or talk to your regular physician about maybe what they've ordered in addition to what you're already taking. I mean, most of our clients, to be honest, a large portion of our clients are taking almost 20 to 22 medications. That's a lot of pills. And if you add one more medication, yikes.
Yeah. And blood pressure is a major thing to mess with, right? So you have to really be careful with those kind of things.
Absolutely. Yeah. So anything else on the Medicare side, or, that you think is important?
I do just want to say that, Medicare agencies, we worked with several of them, and they're really good. And they come in handy because your Medicare or Medicaid, like you said, will pay for some of these services. So it does help when you're going home to take advantage of these, and, use some of those services that your insurance does cover.
Yeah, I'm not 100% sure if they have out-of-pocket fees or not, but maybe in the future, when we, because we want to, have somebody on that is working for one of the local companies, talk a little bit more in depth about their services. Because another way, like if you're at home, a couple of things I remember about these agencies is that if you're at home and you're having falls, your doctor can order, even though you didn't get discharged from a hospital or a nursing home, rehab facility, your doctor can still order it. So if you're having a lot of falls, you could call your doctor and tell them when you've had falls, and they will, are able to get you that benefit. And then the other way is if you have a wound, an open wound, that's another way that, you can get wound care nurses coming in a regular basis to help oversee, that wound, and help, care for it and care for it properly, whether it's, changing the bandage or cleaning it. But again, these are just going to be intermittent. So sometimes we get families calling saying, I need a nurse to come in and, do wound care every single day, because Medicare is only going to pay for that nurse 1, maybe 3 times a week, and then that's it. The family has to figure out, or the client has to be able to do it themselves.
Right, absolutely.
Yeah. So, okay, then I think we're good to move on to private duty home care.
Yeah, so private duty is quite a bit different in some ways, as private duty is not required to be licensed by the state. I put on here no doctor's order, but it depends. So if you're paying out of pocket, then you get to dictate that, and you don't need a doctor's order for having somebody come in and take care of mom for what she needs. But if you're going through like a long-term care insurance or something like that, you may need a doctor's order or auto
Okay, so Krista,
insurance.
I want to
Yeah.
touch base a little bit on that, no license required in the state of Michigan. Yeah, because I think that's really important, for folks to understand that of the hundreds of thousands of what we call private duty home care agencies, Michigan is really, a state that allows you to provide this care without having any licensing.
Mm-hmm.
And so what that means is buyer beware, right?
Right.
What it means is you really need to do your due diligence in regards to finding an agency.
Yeah, because really, I mean, in that case, anybody can have an agency, so you really have to dig deep and talk to everybody and, look at reviews and figure out what's important to you when you're looking for a home care in Michigan.
Right. Absolutely. And ask a lot of questions. And, yeah, I like to say one thing, which is that when you're calling, you're kind of on guard for everything, right? Did they answer the phone? Did they return the call? Because all that matters in regards to service. So if they didn't answer the phone and they called you back 3 days later, that's going to send you certain signals. So if you're expecting service at a higher level than that, then, you've got a problem, because they've already set the pattern with you with the level of care that they're providing, right?
Yeah, absolutely. And that's a really good point because, yeah, I mean, I would be worried about that if I was calling for home care and had to wait for somebody to answer the phone or call me back, or, seem scattered when I'm talking to them. I'm looking for a home care that's going to give me some relief and make sure that my family member is taken care of. It's not like you're working at the bank, you have people to worry about. So you have to really pay attention to some of those little things when you're calling.
Well, and I would say one other thing about that, and it's kind of a big topic because not every agency has the same level of standard, right?
Mm-hmm.
So,
Yeah, that's very true.
I mean, you just look at backgrounds checks, if you look at drug testing of the staff, if you look at, are they skilled to be able to do the level of care that they say they can do? All that makes a difference. Those are all things that can be inconsistent in this industry, right?
Yeah, and I think you have to pay attention too, like if you're calling for your mom who maybe only needs companion care right now, but down the road, can this agency take care of her as maybe she progresses, and the skill level gets higher and higher? Or am I going to be able to stay with this agency? Do they have those people with that skill set? And if not, do they have training available to make sure I can keep those caregivers that I like, or that I can move forward, as mom progresses? So it's definitely something to think about too.
Right. Absolutely. So no license in the state of Michigan. Most families do not have to get, an order, I guess if you're in a catastrophic auto accident, which we provide, care for, yeah, they would need an order, but a general family just needing help with mom in the home typically doesn't.
Right.
Yeah. So you want to go over the kinds of care that, is typically found in this industry?
Yeah, usually home cares do have nurses and, RNs that are available. But their visits are going to be a fee to the family. So they can absolutely do things like wound care or medication management and, anything that you need help with nursing wise. Um, we also do provide that physical therapy and occupational therapy, but again, for a fee. And then we also have home health aides. And the difference between home health aides and private duty home care from Medicare is that we normally can come in and do shift work. So, like our private duty home care, we're available 24 hours a day, 7 days a week. So it's up to the family to say, my mom needs care the most during this time and this time. And you can have a home health aide for 4 hours all the way up to 24 hours of care. That's, completely up to you and what you want to pay for and what your family member needs.
Right. So I think about the level of service, in some agencies will provide you with hourly nursing, right? You've got levels of care. So they could get nursing visits, they could get nursing hourly care, because some people, and the skill is much higher, for
Yeah.
somebody who's a nurse, or a caregiver. And then we've got some clients who have a nurse and a caregiver,
Right.
so you can mix it up however you want. But I just want to touch on maybe a couple of, this is, for the most part, we're talking about an out-of-pocket expense. But when you talk about, well, why would my loved one need to pay for a nurse out of pocket? We've seen for maybe like needing weekly or biweekly med setups or medication management to make sure that that's being set up properly.
Yeah.
We've had some that had wounds in spots that they couldn't care for, and Medicare was only doing a few visits a week, but they needed help on the other days to change bandages and keep that area clean.
Yeah.
And then we've had clients in the past that were worried about just doing infusion. One gentleman we had at infusion 3 times a day coming home from the hospital. His wife was in her late 80s. And they weren't able to, Shirley did not want to be infusing any medication into her husband. So in that was another situation where, they paid out of pocket to have a nurse come in to make sure, that it was done. And then it's short term for the most part.
Yeah. Yeah. But there is a real value in that, the private duty nursing, because, for the most part, they're big picture, right? So they're going to look at a lot of those things that might be issues and really help your family get through some things that maybe you didn't even know were an issue. I didn't know how bad this medication situation was, or, maybe a client's been feeling sick, that whole time because they're taking the wrong medication at the wrong time of day, so you just never know what kind of situation a nurse will help.
Right. And when we talk about the caregivers, we're talking about doing, assisting with showering, companionship, walking, ambulation, doing activities, keeping them, cognitively, are there things that they like to do, and, or go out or take them for a ride, transportation, as long as they're not wheelchair bound, our caregivers can do that as well. And, making meals,
Yeah, that's a big
ensuring that
one.
they get fluids, medication reminders, those are all things. But, ultimately, I think it's every family has a certain need. Everybody's needs are different,
Yep.
and some
What's
have
important to
pets,
somebody.
right?
Yeah.
Some have pets still, and they need help, letting, Fido out, or,
Yep.
feeding Fido and making the dog has, food, or cleaning the cat litter. Our caregivers do that as well.
Yeah. Anything that, maybe somebody did independently before, but they need help with now to remain in their home, safely in their home.
Right. Especially, I like to say, recovering. Sometimes we get those family members calling saying, mom's been in the hospital, she's in the rehab, she's coming home. I have no idea. What do we do then? How do we help them work through that?
Yeah, I get a lot of those calls, because I think, especially when it's somebody's first time dealing with anything like this, it's overwhelming. I don't know where to begin or who does what or who I even call.
Yeah.
And so we try to be really helpful in that scenario. But it's what I would say is you got to ask a lot of questions, have a checklist ready for the things that are important to you when you're calling a home care, even if you don't know a whole lot about what it actually is. What's important to your loved one, what things are you worried about, and how will that home care agency be able to handle those things? That's a really good start. And usually when you start talking about those things, you come up with other things, you start thinking of other things that may happen or come up, or it really just, it's asking a lot of questions, making sure that you're talking to somebody who knows the answer to your questions.
Right. Well, and we also sometimes get those like clients who say, I don't need help.
Yeah.
I'm fine. I always like that one. I'm fine.
Yeah. Well, I think it's hard to have somebody, like, I don't want somebody to come into my house every day. I think it's hard to realize that, hey, you may need some help, and maybe I don't want a stranger in my home. So it's really, you got to be comfortable with the agency you choose, and what they're doing to choose an employee to come into somebody's home. Somebody who has a good personality match with your loved one is really important, because if you can get that right, then sometimes the rest falls into place. I see a lot of time the resistance is purely fear,
Yeah.
fear of the unknown.
Right. Who are these people? Who are these strangers coming in my home? Can I trust them?
Right.
What do they want from me? But sometimes there is that overall inability cognitively to realize that they're not doing well and that they do need the supportive services. So, I know sometimes you are helping families, and give them advice in those situations.
Yeah. Yeah. There's a lot of processing that comes into place with that. And what I normally end up saying to them is, sometimes you need an outside source to really have people realize that. Example I use a lot is, trying to get my daughter to swim, right? I'm like, you can swim, let's go swimming, let's learn how to swim. Resistance, resistance, resistance. But as soon as, that swim teacher tells her to get in the pool, she's in, no problem, right? So it's kind of the same thing. Family members, okay, yeah, I know my family's telling me I need to do these things, I need help with this, I should do this, I should do that. Somebody from an outside source that has information that's imperative, we come in and talk about that, then sometimes it's eye-opening for them. Okay, well, it's not my family telling me to do it, so I guess I must need it. So that's a big thing, because family members, I find, get really upset, when they can't get through to their loved ones in this kind of situation.
Well, and the situation's a little bit reversed, right? This is the story about swimming is you and your daughter. Now I'm telling my parent, we're kind of reverse these roles, and I'm telling my parent we need to get this in place. And she might be screaming at me that I don't need this and slamming doors and doing what I like to say is having an adult temper tantrum, because it's going to work. And we've seen family members kind of back off because they're thinking, hey, mom, we don't want to upset mom, the apple cart, even though things aren't going well for mom, right? So we have so many success stories, though, even one recently where had doors slammed in our faces, we don't need help. We've had people not answer the door, but if we remain consistent and persistent and we have that family just, back us up and, especially I would say not talk about the cost, because many times the elderly folks are worried about how much money they have and do they have enough to make it through the rest of their lives. And they make that as the objection for not getting help. So sometimes we will, give recommendations to families on how to talk and get through that with their parents. But many times we don't want the parent really seeing what that overall cost is, because then they might put the squash on it. But, in that situation, that one situation that we just had where, she wasn't willing to answer the door, we just remain persistent with it. And we've seen her like really start to flourish. And, you go there now and she's happy and smiling and chatting, versus when we first went there where she was in a really bad place mentally. So, I know that you have on your inquiry calls help families a lot with, having that conversation, working through that issue with their parents.
Yeah, I think, a lot of it is discovering the pain, what is the greatest pain, that they're having, and how do we get them to realize that, and that, the value of us or other home care agencies, would take that pain away, right? So we have to prove ourselves we're going to provide value of some sort. And then if we can do that, usually cost is not the biggest problem, right? Because you can show that, okay, life is just going to be a little bit different, a little bit better for me. Is that worth paying something for? Absolutely.
Yeah.
Absolutely. Am I going to be safe? Am I going to be happy? Do I have people that, want to take care of me? Yep. Then I'm going to pay for that.
Right. Well, and most families, if you have even $100,000, $50,000, spending down in the home is such a safer environment, right? Than, moving out into a community or moving to a nursing facility. Use that money while you can before you make that final change into the next step.
Yeah, absolutely. And you always, at least I feel like you always want to try and stay in your home safely as long as possible. The home is the best place for people to be, until you absolutely can't anymore. So even if you don't go with our home care agency, I still feel like it's a real benefit to be in home as long as possible.
Right. So when we talk on here, we talked about services provided being bathing, transportation, meals, and I like to say, I always use my top three are more fluids, medication, and meals. Like if we can, get help and get those stabilized, then a lot of times whatever client we're working with will see, improve or, at least not decline, I would say, for the most part, unless they have, some disease that's affecting the situation. So, but length of service, you want to touch on that? Like, is that hours you're thinking?
Yeah, our length of service, it really depends on the family and the needs. So like for us, we have a 4-hour minimum for somebody to come in and do a shift, so caregivers can come in and do those hours, or if mom maybe she needs a midnight person, she gets up during the night and you're worried about those 12 hours or whatever it may be, we can do that too. As far as long as we're in the house, it can be temporary and it can be a really long time that, we're providing care for a family. So sometimes people, use us for when just after the discharge, and maybe if the family member can get up and get back to normal life, then they don't need us anymore. But sometimes, we take care of people for many years. And so it really just depends on what people need.
What can you touch on, because sometimes we do get those calls from families who say, like my mom only needs an hour and a half to 2 hours and she wants them in the morning and at night.
Yeah. Yeah, I do get those calls sometimes, and I think it's just, when people don't understand how that works. And so, that's more of what Medicare does. They might be in there for an hour, so we can kind of talk through that. But for us, we're having a very qualified caregiver come out to provide care. It has to be for that at least 4 hour period to have that person come out and provide that care. I mean, there's only so much somebody can do in an hour anyway. Are we really providing something that's helpful in that time?
Right. Years ago, we used to provide those hour-and-a-half visits, but today, in today's economy, I think we're really seeing most caregivers want like a minimum of 4 and really prefer 8 to 12-hour shifts.
Yeah, absolutely. I mean, yeah, even 4 hours nowadays is really tough for people. So, 6, 8, 10 hours, 12 hours. I mean, it may sound like a lot, but that's really what caregivers are looking for. And you may need that amount of care. You may want to try and split it up as much as possible, and it might not be what's best for your loved one.
Right. Yeah. And then do you want to touch on, the cost of service? Because I always feel like, what's the most asked question?
Yeah. Does my insurance pay for any of this?
Right.
Right. Yeah, I get that all the time. Yeah, and no, I mean, it's an out-of-pocket expense, for private duty home care. And it really depends on the level of care that's being provided, what the cost is. And mostly, we determine it by an assessment, creating a plan of care and seeing what that looks like. But um, it's not going to be cheap, and it's not going to be the most expensive thing out there, but it's providing care for your loved one. So, and it is an hourly cost, usually with private duty home care, cost per hour.
Right. I like to say, if you go into a community right now, they're typically have a caregiver per every 15 residents. And
Mm-hmm.
if they're running shorthanded, that'll change to like 20 or 25,
Yeah.
versus if you're at home, this is a one-on-one situation. There really isn't anything to compare it to quality wise, right? You got full attention on your loved one.
Yeah, absolutely. I mean, I don't know about you, but I wouldn't be able to sleep at night if there was, one person taking care of the 25 people in my mom's facility. I mean, how do you get actual care that way? There's nothing like one-on-one care, personality wise. You have somebody that you can trust, somebody that your loved one invests in too. They become like part of the family. And that person is, their sole job is to come in and take care of mom or dad or whoever it may be. And, it's important to them. They have that level of ownership that they want to provide the best care. So that having that one person is so beneficial, especially if your loved one has dementia or Alzheimer's. Having that connection is really important.
Yeah, absolutely. But I would say one thing, there is, if your parent purchased a long-term care policy, and we could probably do a session just on long-term care policies and how to protect your loved one's insurance,
Yeah, I'm sure.
and make sure that you get the full benefit. But long-term care like Unum, or I'm trying to think of some of the other ones out there that,
DNA, I think.
yeah, CNA is a good one. So they would be still typically paying into that today. And those insurance policies are pretty expensive. So
Yeah.
that would be one. The other thing is for home care, we didn't touch too much on it, would be like if your loved one was on active duty and, and has a VA benefit, the VA does pay for home care services. And then, if they are not, financially able to pay out of pocket, but need the help, that folks could reach out to the area agency on aging and, have them talk to them specifically about where they might be able to get some help. I would say right now, because of the demand for caregivers, even the area agency on aging is not able to provide very much help. Families are having to really end up hiring their own, or, kind of trying to figure out, it's a benefit that's not being realized because of the staffing shortage everywhere.
Yeah.
So the only other thing I would recommend, because we do on occasion get calls from people who are like 50 and 60 years old, and my partner, my husband, my spouse, wife, just, she's 5 or 6 years into dementia, and I'm afraid I'm going to go broke, because I look at these costs for private duty home care, and I'm still working, and how do I make sure that I still have money for me? We do get those calls. We just had one of them last week, so
Yeah.
I think, the recommendation for those folks is really looking at Medicaid planning, seeing an attorney as soon as possible, so that you can figure out, so you don't go bankrupt in providing care for your loved one.
Yeah. Always make a plan sooner rather than later. I hate to see people that are, in an emergency situation and don't have a plan in place. So it's never too soon to start planning.
Right. And so just to touch on a little bit, because one of the services that we provide under Alivity Care Advocacy is helping families choose home care agencies,
Right.
screening of caregivers, screening of agencies. Obviously, we have many years under our belt to be able to do that.
Mm-hmm.
And even with Medicare agencies, so that we're trying to basically help them with the navigation and saving them time and energy, because otherwise it's just like, okay, I gotta call 3 companies. What would that look like when, we can just save them time and help get the services lined up quickly. It's like, get to the point very quickly, get the companies that are quality lined up. And we do work even on our home care side of things. We work with other agencies because, we're not able to staff. We staff, the Tri-County area and St. Clair in this area, but, we can't staff, everything. So we collaborate with other quality agencies like us, right?
Yeah, agencies that we trust and that we've worked with in the past. And, like you said, with the care advocacy, we know the tough questions to ask, right? That maybe the family members wouldn't know. And we will be able to see, red flags or those kind of things. So it is helpful to have an advocate look for home care agencies.
Right. Right. So do you want to maybe touch a little bit on what we plan on doing next time?
Yeah, so we're going to do another episode, but I think we're going to go in a little deeper into kind of the things that we're talking about today, coming up with questions to ask when choosing an agency. It's really important to have a checklist of things to go through, and we can help with some of that. And then, of course, possible concerns and red flags and what comes along with that, in a private duty agency or a Medicare agency. We'll start to go into that a little bit further too.
All right. Well, that sounds great. Everybody, I want to thank you for joining us, and hopefully this was beneficial. If you have questions, you can call Krista, you can call me, either one of us. We answer our phones here, and Holly is, here as well in the office. So please call if you have questions, and appreciate you taking the time to see us today, and we will see you on the next session.
Bye, everyone.